Yeah, well, one thing, look, in modern medicine, once everyone goes out into clinical practice, you are going to create an implicit bias of diagnosing what you see a lot of, right? So if you live in an area where, there's a lot of poor air quality, yeah, breathlessness, your first trigger might be it's asthma. So one of the reasons it's underdiagnosed is because of its rarity. With a rare disease, of course, as a doctor, we're going to always think of the more common reasons, the more probable reasons you're experiencing this. Also, because it's rare, a lot of doctors may not have ever seen it. And so they'll try to bend those symptoms into something they potentially may understand a little bit more succinctly. Look, it is a probability conversation. pH doesn't have like slam dunk. If they have this, they must have pH. There's certain symptoms you look out for, but for a lot of young patients who are very active, the second you get loss of that endurance, they're going to come and discuss it, right? So they're not coming in full blown volume overloaded, the heart's failing. That's a late stage, and those patients don't come in at that moment. What I do appreciate about young patients is while they may not go to the doctor regularly, they're busy, but they do go to the doctor if something's off because what they treasure is their youth and health. And if something's robbing them of that, they tend to kind of put themselves on notice. So I think, and I don't have an easy answer of changing that other than these campaigns and these conversations, but your doctors are going to get appropriate. I'm not going to say it's an implicit bias, it's an appropriate bias of, hey, I'm good at diagnosing what I tend to see a lot of. What's the probability of the diseases that are in my region? That's what you want out of a doctor. The rareness of it, even if they can't diagnose it, the good doctor should be able to say, this isn't fitting into what I know. As long as that doctor can make that claim, then she can then just begin, or he can begin to say, let's go to the next step of a workup. The workup is tough for PH, right? Because first usually the biggest thing is getting an echocardiogram. There's other surrogate things, like you can get an EKG, sure, but like these are like proxies. An echocardiogram really helps recognize something from a volume standpoint is happening to the heart. And then after that, then you have to coordinate a right heart catheterization and really help with a definitive diagnosis. And then there's other workups. And so the last part is even if you have an astute doctor who clinically suspects something, that collaborative workup of investigating pH, it's not something routinely available at every hospital. If you're out in rural America, you got to find yourself a heart center that really knows how to investigate this. So and this is not an issue with pH, this is an issue with any rare disease where unfortunately, not unfortunate, but they congregate at academic centers. And so then you're faced with what's the propinquity of the next academic center that I can go and get my care at. So those are conversation pieces around the underdiagnosis overall. It's the first line of picking it up, and then the workup that, again, who can do it and where can you get it done? I think the patient advocate groups can play a role in two ways. One is actually just getting the word out. I mean, the challenge with rare diseases is they're rare to everyone, right? We never heard of it. So it'd be good to just have these conversations, get them out there, and because at least what can happen is a human being sits back, goes, I, I may have those symptoms. I could just take it to their doctors. Look, in this day and age, most people are mindful of the symptoms they have. I don't get a lot of hypochondriacs. I get a lot of people who are coming to me with real problems that like, you gave me an inhaler, it's still not working. Do you think this could be it? Great. Then the doctor and the patient can work collaboratively. I love it when patients feel like it's their body. They should take advocacy around like what else could be going on if the treatment the doctor installed it for me or provided me isn't working. So the advocacy groups can help get the word out, especially to the lay audience, just so they can hear it and they can understand it. The other aspect that they can do with advocacy is letting know the lay audience how difficult this disease is to manage, right? And I see this because, the tools we use for certain diseases sometimes may be available for the general population. For example, the face masks. Right before COVID hit, a lot of my rare disease patients, this isn't so much PAH related, but like cystic fibrosis related. They wore those face masks. Oftentimes they were massively infected, didn't want to spread it. And then so like, the fact that the face mask became politicized, became kind of an adverse visceral response for many, you suddenly stigmatize also a rare disease population who saw that face mask as really important. So what I would encourage the advocacy groups is also to help the general population be comfortable with people who walk around with certain rare diseases like PAH, because many of them may have ports and subcutaneous injection sites for their medications. That could create a stigma that they don't want, and you know, you look sick because you have that. Again, there could be ways you can help offset that. The other aspect of the advocacy groups, especially for female male patients, like birthing and fertility, like some of the medications, we really advise you not to get pregnant while on line. And so having a support group to discuss fertility timing, what it means, or even family planning overall. These are important conversations, and it's where I try to direct, especially my female patients too, because these are important conversations for them. When they get diagnosed, they plan on some point in time of having a family, and now they feel like that timeline is being robbed of them. So you want to give them that general support. So advocacy for raising the awareness, advocacy for kind of the general acceptance of this rare disease. And I tend to point my patients in those kind of directions too, depending on who's got good resources and so forth. Yeah, I think for me, you know, being mindful of first of all, the breathlessness, that's a key factor. So you always want to gauge where patients are with their endurance level. Some level of monitoring their pulse oximeter. I think that's always important, but I don't honestly blanketly to say just measure it. Like it's usually should be tied in with how they're doing from a symptom standpoint because the bodies in general are wonderful. They're going to learn how to adapt. And so sometimes a very low reading, hey, just give me a second, it'll bounce right back to normalcy. So I just tell them there's certain vital signs we would encourage you, certain signs like pulse oximeter, weighing yourself, seeing if your ankles are swollen today. All are good, but make sure we can always tie it back into how you're feeling. So what I would encourage my patients, hey, call me if your oxygen levels are too low and they're not coming back up and you feel it. You are breathless. Let us know. Call us urgently. If you've suddenly gained more weight than you were expecting and it's hard to come off with some of our medications over 48 hours, even if you're kind of in a subtle level of symptoms, let us know. I mean, from my standpoint with my patients, my threshold is very low for them to call me because especially for newer patients who are getting used to the symptoms and the medications impacting on them, I'd rather you call and we can dismiss it as like, yeah, it's manageable, it's not important, rather than delay it and say, ah, I wish we had this earlier. So every patient's a little different. We'll bespoke the plan to them. But the encouragement is anytime something feels off, you guys know your body better than us, let us know. We'd rather be inundated with information than have a dearth of it and suddenly we're sending you constantly to the hospital.